Hey everyone, and welcome to The Explainer. I am absolutely thrilled to have you here today because we are taking a fascinating, really deep journey through the systemic lens of addiction. For decades, we've kind of looked at addiction through this incredibly narrow window, right? Treating it either as a moral failing or just purely as a deterministic brain disease. Well, today we are completely moving past those reductionist models. We're going to look at the research, the data, and the biology to understand how we actually heal by looking at the entire architecture of human recovery.
Okay, let's just dive right in. Here is our syllabus for today. We'll be covering dislocation and trauma, the neurobiology of compulsion, psychological flexibility, mindfulness and urge surfing, and finally, we'll wrap up with community integration.
Starting off with Section 1, Dislocation and Trauma. Let's talk about the environment. For the longest time, the dominant narrative out there was that addiction was simply a chemical hook. The idea was you take a substance, your brain gets hooked, and, well, that's it. But what if addiction is actually a systemic adaptation to profound dislocation and pain? Back in the late 1970s, psychologist Bruce Alexander conducted this absolutely mind-blowing experiment called Rat Park. Before this, studies would just put rats in tiny, isolated cages, give them drug-laced water, and basically watch them relentlessly consume the drugs until they died. The conclusion everyone drew was that drugs are just inherently irresistible. But Alexander, he completely changed the environment. He built Rat Park, this massively enriched 8.8 square meter enclosure filled with tunnels, wheels, and 16 to 20 other socializing rats. Both the isolated rats and the Rat Park rats had access to normal tap water and morphine-laced water. And the result? Get this. The isolated rats drank up to 19 times more morphine than the socially enriched rats. In fact, the rats in Rat Park mostly avoided the drugs altogether. It turns out the cage matters just as much, if not more, than the chemical itself.
Now, obviously, as humans, our cages aren't usually made of literal metal bars. Dr. Gabor Mate perfectly maps this concept to our internal development. We often think of trauma strictly as big T trauma, the overwhelming, obvious events like severe abuse or violence. But equally impactful is what we call small T trauma. This is the subtle stuff. It's the ongoing emotional neglect. It's when a child's fundamental needs for connection just aren't met. Dr. Mate points out that even doting, loving parents who are chronically stressed out can inadvertently inflict this small T trauma. The wound isn't just about the bad things that happened to you, it's also about the good things that didn't happen, which leaves this lingering, painful emptiness inside.
And that brings us to this incredibly powerful quote from Dr. Mate. All addictions come from emotional loss and exist to soothe the pain resulting from that loss. When you look at it from this perspective, addiction isn't a disease in the traditional sense at all. It's effectively a refugee story. It's this deeply unconscious, desperate attempt to escape from the intolerable pain of those internal cages. The addiction serves a real purpose for the person. It soothes a deep, often unrecognized pain.
Moving right along to Section 2, the neurobiology of compulsion. Let's look at the brain's hardware. Okay, so we are zooming from that big sociological cage right down into the micro level of the brain's reward circuitry. Have you ever wondered why someone might continue to engage in an addictive behavior even when they clearly, undeniably aren't enjoying it anymore? Well, this is explained by the Incentive-Sensitization theory, developed by Kent Berridge and Terry Robinson. It basically defines addiction as the neurological decoupling of liking a substance from actually wanting it. Over time, the brain literally permanently amplifies the compulsive craving, the wanting for a substance, long after the actual pleasure or the liking derived from it has completely faded away.
What's genuinely fascinating here is how distinctly the brain separates these two feelings. Liking, that actual pleasurable impact, is mediated by these really small, fragile hedonic hotspots in the brain. It's delicate. But wanting? That is driven by incredibly robust, deeply ingrained mesolimbic dopamine projections. And this explains why a person can be triggered so easily. Studies have actually shown that if you flash a picture of cocaine to an addicted individual for just 33 milliseconds, which is so fast they can't even consciously register seeing it, it instantly triggers that massive wanting dopamine pathway, sparking this intense desire without any conscious enjoyment whatsoever. So how do we frame this medically? Well, the standard brain disease model often views addiction strictly as a chronic, broken brain state that results in a total loss of free will. But researchers are really moving toward a much more systemic view now. The human brain is a multi-layered control system.
Addiction doesn't just completely erase your decision-making. Rather, it creates what's called a biased choice. Your goal-directed behavior becomes severely skewed towards short-term relief. The brain is basically adapting. It's satisficing immediate survival, like escaping that internal pain or withdrawal, completely over your long-term values. But wait, this leaves us with a massive question, right? If the brain's goal-directed choice is biologically biased toward immediate release like that, how on earth is willpower restored? How do we intentionally course-correct a system that is fundamentally skewed? Which brings us to Section 3, Psychological Flexibility. Let's talk about ACT and clinical interventions. To course-correct that skewed system, we use an amazing framework known as acceptance and commitment therapy, or ACT for short. This is all about transitioning the brain from those rigid survival patterns back to conscious, flexible choice. But to understand ACT, we first have to understand the enemy here, experiential avoidance. This is the tendency to suppress or try to escape uncomfortable emotions, thoughts, or physical sensations. This is literally the engine of the addiction loop. It's the internal struggle switch. That desperate urge to escape the internal cage of discomfort is exactly what drives the addictive behavior in the first place. So, the absolute game changer is that ACT doesn't try to eliminate your symptoms or cravings. Instead, it rebuilds your psychological flexibility through 6 core processes: acceptance, cognitive diffusion, being present, self as context, values clarification, and committed action. Think of this as a syllabus for completely changing your relationship with negative emotions. Instead of fighting the craving tooth and nail, you actually learn to sit with it, figure out what you genuinely value in life, and take committed action toward those goals, even when the internal discomfort is screaming at you. I really want to highlight one of these processes specifically because it's so cool. Cognitive diffusion. This is incredibly powerful. It means creating distance from your thoughts. Instead of your brain screaming, "I need a drink right now," and you treating that as an absolute command, diffusion teaches you to step back and shift that to, I'm having the thought that I need a drink. It sounds ridiculously simple, I know, but that tiny bit of distance, it completely breaks the automatic pilot of craving. You learn to view the thought as just a passing mental event, not some ultimate truth that you have to act on. All right, Section 4, Mindfulness and Urge Surfing. Let's look at the practical application of this. So, practically speaking, how do we actually do this when a real craving hits? In mindfulness-based relapse prevention, there is this brilliant, concrete mechanic called the sober breathing space. First, you stop or slow down your habitual reaction. Then, you observe what is happening internally without judging it. Third, bring your focused attention to your breathing. Fourth, expand your awareness to your whole body. And finally, respond mindfully. This little exercise actively interrupts that 33-millisecond dopamine flash we talked about earlier. It expands your behavioral repertoire so you aren't just instantly reacting on autopilot. And this flows right into this beautiful concept known as urge surfing. It's noticing the craving without pushing it away and just letting it be there, like a wave that will naturally rise and fall. You are moving away from rigid willfulness, fighting the craving with everything you've got, to observational willingness. You simply sit with the discomfort as the wave of that dopamine-driven craving crests and then naturally breaks. You just ride it out, knowing for sure that it will eventually pass. Finally, Section 5, Community Integration. It's time to rebuild the ecosystem. Because sustained recovery fundamentally requires rebuilding a healthy environment. Just look at how our understanding has evolved over the decades. Back in the 1970s, Rat Park showed us the profound dangers of environmental dislocation. Then in the 90s, we mapped the brain's wanting pathways. The 2000s brought the brain disease model, which really highlighted the clinical biology of it all. And now, here in the 2020s, we are seeing acceptance therapies that synthesize all of this together: the environment, the brain, and our behavior. It is a truly holistic view of human healing. And this holistic view really helps explain why long-standing community frameworks like 12-step programs are just so deeply effective. They basically act as a form of narrative therapy. By doing a shared moral inventory and practicing communal honesty, individuals actively deconstruct their childhood survival traits. They mitigate that learned helplessness and foster profound life-saving community trust. They aren't isolated in that tiny cage anymore. They are healing together. So ultimately, successful clinical recovery is basically about the active construction of your own human rat park. It requires the restoration of routine, fostering deep interpersonal connection and vulnerability, pursuing intentional activities that actually align with your core values, and fundamentally transforming that isolated internal and external cage into a thriving, supportive ecosystem.
Which leaves us with one really big, provocative question to ponder today. If addiction is genuinely an adaptation to our environment, to our dislocation, and to our trauma, what shifts must we make in our society to prevent the cage from being built in the first place? It's not just about treating the individual anymore. It's about evaluating the systemic stressors that are driving addiction in our modern world. Thank you so much for joining me on this deep dive into the architecture of recovery. I really hope this explainer sparked your curiosity and gave you a whole new lens through which to view human resilience. See you next time.